And the way we're going to name them has to do with how they're interacting with the head. So it's where does this muscle insert on the head is how we give it its name. I'm only going to really review the horse and the ruminant. The pig, I don't care if you know about it in this region, just because it's the pig and we don't do a lot of neck surgery on the pig. And the dog you had last semester. So let's look at the horse. The horse, that sternocephalicus muscle, is going to be starting from the manubrium of the sternum, and it's inserting up here on the mandible. In the case of the horse, the sternocephalicus muscle, even though it's singular, is best referred to as sternomandibularis. Let's turn our attention to the ruminant. And this is obviously an ox. So the arrangement that we have here is what we would find in the large ruminant, the ox. First one we're going to look at is this muscle right here. You can see that it has its typical origin, and now its insertion point is a little bit different. This muscle is the sternomastoideus. The sternomastoideus. We do see species variation in the ruminant in the sternomandibularis. In the case of the ox, we have a sternomandibularis. It's inserting on the mandible. In the goat, this insertion is moved in this direction, and it's now inserting on the fascia overlying the zygomatic arch. In the goat, this muscle would be referred to as sternozygomaticus. In the sheep, this muscle is absent. So sheep will have the sternomastoideus, but they have no analogous sternomandibularis muscle. Let's now look at the clitocephalicus muscle. This clitocephalicus muscle goes from your clavicular intersection up to the head. In the case of the horse, we can see our clavicular intersection right there, and if we follow the insertion point of this muscle, it is on the mastoid process of the temporal bone. In the case of the horse, they have only the clitomastoideus portion of the clitocephalicus. The ruminant, and here we can use ruminant, is going to have two parts to this clitocephalicus muscle. If we follow these parts up from our clavicular intersection right there, we can see this part right here inserting on the mastoid process. So the ruminant has a clitomastoideus. And a second part right here inserting on the occipital bone. So the ruminant also has a clito-occipitalis. Back here, they're fused pretty tightly. And then what you'll see is they'll split as they near their insertion. And what we're naming them by is their insertion point. And having said that, you can see your omotransversarius muscle right there. This muscle in the horse to some degree and the large ruminant as well will fuse into the clitocephalicus muscle. And all of these muscles can just become this huge mass of meat and really hard to discern what you're looking at. And you'll see that today when you start really tearing in to the muscles of the neck region. Pay attention to the insertion site. And having said that, if I'm going to pin it, if I pin it in the middle, you can't say anything more than clitocephalicus. If I pin it on an extreme, like here or here, then I'm trying to force you into a distinction. And usually I try to be pretty fair about it. I think I'm pretty fair about it. You might disagree. That's probably a better way to put it. So here's your key, and that summarizes pretty much everything we talked about on that slide. So now let's take a look at a few of these muscles to review. You have your cleidoaccipitalis, your cleidomastoideus right here. You can see your sternomandibularis coursing in this area here, and then your sternomastoideus will pass deep to your sternomandibularis on its way towards its insertion point. A few of these muscles in this area I do want to spend a little bit more time talking about. That has to do with the long hyoid muscles, the sternohyoideus and the sternothyroideus muscle. Of these two muscles, the sternohyoideus is more medial, and we can see that right here. Does anybody remember where the sternohyoideus muscle inserts? Yep, inserts on the basihyoid. The sternothyroideus muscle is more lateral. Everybody remember where the sternothyroideus inserts? Thyroid cartilage. Perfect. Now, based on the insertion points of these two muscles, and the fact that the hyoid apparatus is responsible for coordinating movement between larynx and tongue, these muscles are important in swallowing, not really head movement. And these two muscles, when you look at them collectively, right and left side, if you hyperextend an animal's head, really hyperextend their head and try to give them a pill, they can't swallow it. It's because these muscles have a lot of tension built up into it and prevents the tongue from functioning properly. You can see your omotransversaris coursing right in here, and this is where you can see that omotransversaris passing medial to your cleidocephalicus, and this is where we can end up with a fair amount of, they blend together and can be really hard to separate. If I throw the term omo out there, what does it mean to you? Shoulder. Something pertaining to the shoulder. We're going to look at a new muscle. This is a muscle you did not have in the carnivore, and this is the omohyoideus muscle. Unfortunately, in the ruminant, the name is going to lead you astray because the muscle itself, I'll point it out in black, right there. The omohyoideus, in the case of the ruminant, starts from the fascia that overlies the third and fourth cervical vertebrae. So it has nothing to do with the shoulder. And you should be able to find that muscle, so it's going from that fascia over C3 to C4 to the basihyoid. We have fewer of those muscles that are easily visible here on this particular diagram. You can review your cleidomastoideus and your sternomandibularis muscles. In the case of the horse, things always have to be slightly different than what we see in our other domestic animals. And that's going to be in the sternohyoid and sternothyroideus muscles. In many of the specimens, you're going to see the sternohyoideus and sternothyroideus running together. And you can't separate them. They look like one massive muscle. This muscle will be referred to, or you'll see it referred to, as the sternothyrohyoideus. So it's really just indicating that these two muscles, we can't tell which one we're looking at. And once again, when we have muscles that have a common origin, we can have this fusion occur. And the horse just takes it a step further than what we normally want to see. A lot of times you can't really see the separation in these muscles until very far proximally in the neck, so very near their insertion point. And every specimen's a little bit different. So be prepared for that when you're looking at your specimens today. They might separate out real early, or they might do it very near their insertion point. I'll give you another minute break because we're going to spend a fair amount of time on this slide. Okay, on these cross sections through the equine neck, I want to take a little bit deeper look at the jugular furrow. And within the jugular furrow is where you find the external jugular vein. And this vein is extremely important for obtaining venous samples and intravenous injections. Having said that, I now think it's important that we know what structures are around the external jugular vein. We're going to start with the C4 level, right in here. And dorsally, the muscle that forms the dorsal boundary of our jugular furrow is your clitomastoideus. The ventral boundary is going to be your sternomandibularis. And your deep boundary is the omohyoideus muscle. And in the case of the horse, the omohyoideus muscle lives up to its name. It does start in the shoulder region, and it inserts on the basihyoid. The other thing is, in the horse, this omohyoideus muscle is much thicker than it is in the ruminant. Now let's take a look at this deep or medial boundary of our jugular furrow. Does anybody have a guess to what 24 might be? Common carotid? How about 27? Vagosympathetic trunk? 26? Recurrent laryngeal? I think I heard that. So that recurrent laryngeal. This omohyoideus muscle now is providing some separation between the external jugular vein and the common carotid artery. And this common carotid artery is feeding blood to the brain. So if you end up injecting into the common carotid artery, you can kill a horse. They're not very tolerant of overdoses of anesthetic going directly to their brain. If you now transfer to C6 level, we can see our external jugular vein right there, and the common carotid artery are in very close proximity to each other. That's because this omohyoideus muscle hasn't moved ventrally to be located in between the two. So based on this increased separation from the external jugular vein and common carotid artery,